Hi there, I'm Dr. Laura Teveni. I'm a American Board Certified Family Physician, and today I'm doing our Medical Minute this week on heat exhaustion versus heat stroke, what it is, how you treat it. So oftentimes when we're exposed to high heat, some people can succumb to symptoms of heat exhaustion or stroke. It's basically the body's losing its ability to self-regulate, so can't control your temperature. Who's at risk? Mostly children, pregnant women, and the elderly. Risk factors could be poor acclimation to heat. So if somebody's not used to the heat and they're exposed to it, somebody with poor physical conditioning, somebody who's ingested alcohol, there are some medications out there that can increase your risks, and restrictive clothing. What do you do and what is it? Or what is it and what do you do? Heat exhaustion is typically mild to moderate symptoms. Typically body temperature is less than 104 degrees. Usually onset will happen with symptoms of thirst, excessive sweating, fatigue, nausea and vomiting are possible, and then increased rate of breathing. Heat stroke is when all those symptoms progress to things like delirium, coma. These people could lose consciousness. All the excessive sweating becomes really dry and red. They're no longer sweating. Temperatures rising above 104. If it gets to those type of symptoms, you need to call 911 immediately. What you can do to treat the symptoms is important. So whenever somebody starts presenting with signs and symptoms of heat exhaustion, the best thing to do is put ice packs behind their neck, put ice packs in their groin, in the axilla or armpits. Also immersing hands and forearms in cold water if that's possible, taking them away from the source of heat. So if they're outside, bring them in to an air-conditioned environment, or fanning if you're outside and that's not possible. You want them to ingest small sips of water, not large amounts of water, as this could provoke and cause nausea, vomiting. And like those big symptoms: confusion, temperatures higher than 104, they're not acting right, dry skin, they're not sweating, call 911. This is a life-threatening emergency. People can die from this, and even if they do not die, if they go into a heat stroke, they can live with lifelong complications resulting from this. Hopefully this medical minute helps. I want everybody to be safe this weekend out there in hotter than hell. This is the reason for this talk this week. And remember, with over 8,000 people expected to be at this weekend's race, please be respectful and please be mindful of the recent rise in COVID. We have another surge, and on behalf of the local medical community, I encourage each and every one of you, when you're outside close to other people, please wear your mask. Be responsible and save a life. Wish the best of luck to all of you out there.